I'm going to come back to the zinc question. We don't have a lot about zinc out there. I think it's reasonable to think it could help the immune system, but we don't have a lot of data to say supplementing one or the other has got benefit like we do say for vitamin D or we do say for some of the other things. The other thing I'm going to comment on, I've seen a few questions and we're about to hopefully start a really exciting trial on is probiotics, right? We have profoundly great data for the benefit of probiotics on pneumonia and the risk of pneumonia. That's the other thing. All of you, if you're in a hospital or ICU that has COVID patients, you should be taking a probiotic. And I would recommend Lactobacillus GG. I have my kids taking it. I have my parents taking it. I have my friends taking it. I don't work for Culturelle, but that's what I'm taking because that has been studied and shown to reduce ventilator-associated pneumonia by 50% in an NIH trial that Lee Morrow did at Creighton. So there is great, well-done NIH-funded data to show reductions of ventilator-associated pneumonias with probiotics. So I would think hard about using them in your ICU in patients who don't have vascular grafts or other risk factors for probiotics. And you can look Lee Morrow's paper up in the Blue Journal. Maybe that's a paper worth posting for you guys. So I think it's reasonable to think about for your patients. I would think about Lactobacillus GG that has the most data, but clearly Lactobacillus plantarum has data. I think there's a few that probably do. GG seems to have most of the data. There's a big Canadian trial looking at Lactobacillus GG and ventilator-associated pneumonia as well going on right now that Deb Cook is doing. The other piece is, those of you who haven't seen it, there is a 4,000 subject Nature paper, the biggest, most impactful journal in the world practically, Nature. 4,000 full-term infants were studied in India. They were given a symbiotic, which is a pre and probiotic together, Lactobacillus and a probiotic FOS. And there was a significant 30 to 40% reduction in respiratory tract infections and sepsis in those full-term healthy infants over time. So much so they had to stop the study because the benefit was so enormous. And that's why the paper's in Nature. So there is 3 large meta-analyses of probiotics in healthy people, adults and kids, to reduce respiratory tract infections, both viral and bacterial. They all are positive. There's a Cochrane analysis of 3,000 patients that's positive. There's a 10,000 patient one that just showed symbiotics are positive. I would be taking them, and I'm taking them every night, I can tell you that, and so is my family. And we have just gotten information from a sponsor that Culturelle has been kind enough. They're going to give us product, and we're going to start a healthcare provider prevention trial of probiotics, Lactobacillus GG, and healthcare providers. Lactobacillus plantarum, Lori, was the second one I mentioned. We're going to start a healthcare provider trial. We hope at Duke. We're working on presenting it now as a concept, and we have a sponsor now for the product, where we're going to start enrolling healthcare workers, hopefully using the HERO platform, which is a BCornet funded platform we're using here at Duke at DCRI to study healthcare providers to see if we can randomize people to probiotic or not and reduce COVID occurrence in healthcare workers. And so we hope we can get this trial off the ground. It's going to take a little work, but we hope we can do it soon. We also are going to plan a trial of floor COVID patients that haven't progressed to the ICU yet, to see if we can prevent progression of disease. And so we're in the process of writing up those trials now and proposing, but there's really strong data for this. I'm amazed more people aren't doing it and talking about it.